Good morning. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 25 new cases of COVID-19, bringing our total to 64. There have been no additional deaths to report. We are aware of one client in intensive care at this time. I do not have any further details to share about that client at this time. Public health investigations continue to confirm details, and information will be updated on our website when it is available. As of yesterday, 6,203 tests had been completed at CADM Provincial Lab. There were 606 tests done on Thursday. We have been reporting test numbers from CADM daily. However, today we have not received the updated numbers, so we're reporting Thursday's numbers. I want to remind Manitobans that an updated public health order under the Public Health Act comes into effect 12:01 a.m. on Monday, March 30th. This will be limiting public gatherings of no more than 10 people at any indoor or outdoor place or premises. Information is being shared with travelers coming to Manitoba by both road and by air. I do note that our borders are not closed, but we are informing all people returning to Manitoba of the need to self-isolate for 14 days. We continue our work across the province to plan our response and building capacity within the healthcare system. This is done through our incident management structure, and it is a provincial-wide approach. We have been standing at this level of preparedness since the beginning of February. I want to thank everyone who's been working long hours and days and weeks to continue to provide help and the safety for Manitobans. This includes our quite dedicated frontline healthcare staff, as well as our lab support, and to all Manitobans who have been stepping up at this time. We've seen volunteers step up. We're seeing Manitobans making social distancing part of their daily lives now. I want to thank you all. And we reiterate that we are not helpless against this virus. We've been taking actions, and we're going to continue to take actions to protect us against the widespread transmission of this virus. Social distancing is one of our best ways to protect ourselves, the people around us, and all of Manitobans against this virus. The best way of reducing the spread is for people to stay home if you can. By staying home, you're protecting yourself, as well as other Manitobans, as well as our frontline healthcare staff. Staying home is especially important if you're sick. It's especially important if you're in a high-risk category for severe outcomes to COVID-19. This includes those over 65, those with underlying medical conditions, as well as those with immune compromise. If you can't stay home, then please practice diligent social distancing, physical distancing. Maintain that 2-meter distance from other people. Avoid large gatherings. Wash your hands frequently. Cough into your sleeve, sneeze into your sleeve. Take these precautions at all times. By practicing social distancing, by staying home as much as you can, we're going to interrupt the transmission of this virus. We're going to reduce the peak of this outbreak. I encourage all Manitobans to continue to access credible information about COVID-19, visiting our website at manitoba.ca/COVID-19. And again, thanks to all Manitobans who have stepped up in our fight against this virus. We're going to continue our social distancing messaging, and if we work together, we can really reduce the impact of this virus on our communities. So thank you very much. I'll pass it to Lanette.
Thank you. So I just want to begin by acknowledging our people who are involved in long-term care and elderly care, the families, the workers, and the residents themselves. The changes that have been made are really disruptive, and we understand that. families who are used to visiting their loved ones who are not able to now, families who are often a key part of the care team are not available as they were. So we just want to acknowledge and express our understanding that these aren't easy times. They won't go on forever, but right now it's important to protect such a valuable population that is at a higher risk. So for the families, thank you. For the staff who are being required to pick up the pace, I guess, in a way, without those families there to support and the volunteers. But also just, I know personally, making sure those residents feel supported and loved. For the residents, you know, it's one thing to have the physical contact, but that social connection is really important emotionally, mentally, and cognitively for them. So I applaud everyone who's trying to find different ways to connect with their loved ones, whether it's just by phone or using iPads, virtual Skype, and things like that. It's a difficult time, and we understand, and we are just grateful for everyone, the families, the workers, and the residents themselves for going through this with us. I also just want to acknowledge some really heartwarming initiative in recent days that we'll put on our social media. In Oak Lake Community School, which is west of Brandon, the students launched a Rainbow of Hope campaign to help seniors stay positive as they manage with social distancing. And in Portage La Prairie, I think it was earlier this week, kids showed up to build snowmen in front of Lyons Prairie Manor. And if you look on our social media, it's quite adorable because even the snowmen are socially distanced, so it's cute. And it's outside the windows of the residents, so very nice. And thank you for the wonderful gestures. Please keep them coming. Those are the kind of things that we need while we're going through this time. So on to operational matters. So Portage La Prairie and Ericsdale opened their community testing sites yesterday. In their first day of operations, Portage La Prairie tested 19 people and Ericsdale tested 6. Pine Falls had an unofficial opening soft launch yesterday at Ecole Power View, and they tested 18 patients. And that site will officially open on Monday with hours from 9 till 4. And as a reminder, these are not walk-in clinics. A referral is needed prior to going there. An update on Dynacare. So yesterday work began with them cleaning up the backlog of people to let them know that for sure that they were COVID-19 negative. So this is relentless but necessary work. And we have, I think they went through yesterday 800 reports they called in, and just cleaning that up. So as the lab tests increase, so will those phone calls to people. So expect to hear more calls back from them on Monday if you haven't already. What else? I think that's mostly it. We did get a comment from one of our surgeons that we know that when people are at home and they're trying to find things to keep themselves busy, they are taking on new projects and healthier lifestyles, trying to keep a proper diet and exercise, which is all great. But we are hearing that some patients are taking on some projects that they maybe haven't before, including power tools. So there's some injuries happening. They're landing in hospital for some treatments and procedures. And so I guess I would just say we're not telling you how to live, well, we're not telling you how to live your life because we've kind of put enough orders in place, but just be mindful and careful and take care of yourselves. That's it. We can open the line to questions.
Thank you very much. A reminder to the reporters online, you have a primary question and a follow-up. From City News, Stephanie.
Hi there, Stephanie from City News. Just wondering if there's any cases, if there's any evidence of that sustained community-based transmission yet.
So we're still investigating many of these new cases. Up to now, we've seen that all of our cases are either directly connected to travel or directly connected to known existing cases. So for that, as long as we are linking them to known transmission chains, then we're not seeing that sustained community-based transmission. We know that as more and more of this virus is introduced into the province, the more likely it is that we're going to start seeing that community transmission. We don't have the sustained transmission as of yet.
Okay, and just as a follow-up, it was a busy day at Assiniboine Park yesterday, and I wondered if you could just clear up some confusion. Some people saying there's too many people in the park, others saying it's okay because it's not that prolonged exposure to other people if you're just passing by them. Just if you could clear up communication about what is okay and what you should keep in mind if you are heading to a busy location like Assiniboine.
That's right. So we definitely want to reduce crowds, so that number is down to 10. So crowded events, public events, we do want to keep those below 10. Getting out and staying active, I think, is important. But if you're finding that the parks or trails are getting crowded, where you're around a number of people, you might want to think about turning back and ensuring that you can keep that 2-meter distance between people at all times. That's the best advice. Certainly, being outside is a good idea. It's a lower risk being out and about. But if you're noticing that the group sizes are getting large, I would advise turning back and finding another place to be outside.
Thank you.
From CBC Manitoba, Bryce.
Hi there, Bryce with CBC Manitoba. I guess my first question is, has the province reached out to any Manitoba scientists or researchers to help with testing and processing samples? We've heard from a prominent researcher who says that there are many people like this in the province with lab infrastructure and they know how to support it, but they haven't actually been asked or enlisted into this effort.
Yeah, so our lab is connected nationally, connected within the province. So they've looked at a number of ways to increase their capacity, and there's a number of innovative things going on right now. The issue is, up to now, is that reagent. So it's not lab capacity that is the rate limiting step. It's the reagent. So there's lots of capacity in other places, but they would have the same issue with obtaining that reagent. So we're the lab's looking, and the lab has increased its capacity, came up with innovative strategies to increase to where we are now, well connected nationally, well connected within the province. So they're constantly looking at ways like this.
All right. So I don't know if this follow-up would be then for Lanette or not, but I wondered how many ventilators are currently in operating rooms or surgical suites in Manitoba, and whether those could be accessed for use for COVID-19 patients.
Yeah, they're a different type of ventilator, but they could be used in certain situations, absolutely. I'm trying to just, off the top of my head, there are hundreds of operating rooms. So we haven't been keeping track of those numbers, but I would say it's in the probably around 200, just a guess, but we can go back and get those final numbers for you. But we're more keeping track of our preferred type of ventilator, which is in critical care and cardiac areas, but available if we do need them.
Okay.
From CBC Radio Canada, Catherine.
Hi, Catherine Logan from CBC Radio Canada. I was just wondering if there's any word on the school situation right now.
Oh, I'm sorry, could you repeat the question?
I was just wondering if there's any word on the school situation right now.
Well, we have we've continually looked at that situation. There's likely going to be addressed in the upcoming week, so there's more to follow on that.
Okay, thank you very much.
Jeremy from CTV Winnipeg.
I'm wondering, has the province had any contact with Hutterite colonies, and are they more at risk because of their communal lifestyle?
Yeah, we've reached out to all groups of Manitobans, including Hutterites. The crowding situations within any space we know is a risk factor. So we've been providing them with information, just like all Manitobans, strategies to enhance physical distancing. And so we'll continue to work with them, with all Manitobans, to try to find ways to enhance the physical distancing strategies.
And a follow-up unrelated to that question, I'm wondering, do we have any word yet on any recovered patients in Manitoba, or are we at a point where we can start discussing that?
Yeah, we are at a point where we're going to start seeing that. And it has occurred. I don't have the official numbers. We're still waiting to be able to report on that. But as we see, what we'd expect is people who are recovering at home 14 days after symptom onset, not 14 days after a diagnosis, but 14 days after symptom onset, we would consider them recovered. And so you can see through our timeline, we're going to expect to be able to report on a number of those going forward.
Josh from the Winnipeg Sun.
I apologize if I missed this earlier, but I didn't quite catch the total number of tests done yesterday and how many tests were processed.
That's right. We didn't have the numbers this morning from what was done yesterday, so we just continued to report what we had on Thursday. So we're going to try to update that as soon as we can and post it on our website.
Okay. And those numbers would include the health link numbers?
Health links numbers.
We don't have those numbers today.
We don't have those numbers today. They went through another phone upgrade. They have hundreds of lines available, and we don't have the total volumes, but we will report those as soon as we get them.
From the Winnipeg Free Press, Melissa.
Hi, Melissa Martin, Winnipeg Free Press. BC yesterday released some new details on its modeling, including some data showing that they think mitigation efforts are having an effect at flattening the curve there. I'm just curious about where we are in Manitoba relative to any internal modeling you've done, and also would Manitoba consider sharing some of that as we go forward, as BC has done?
Right, so we are working on that, and we will try to get something together. All along, we've had early statistical analyses done. Certainly, if we look at BC, where they've had the case, since the end of January, we are at different points in our trajectory to do modeling. But we are working on that right now. We have partners at the national level helping us, and we can, hopefully have some numbers that we can share with Manitobans in the upcoming weeks.
We move on to Eric at Global News.
Hi, this is Eric from Global. Have we seen any more hospitalizations the past few days?
More hospitalizations?
Yes.
Yeah, so I'm aware of the one currently in ICU is what's been reported to me. And we rely on those reports going through our surveillance unit. So we're going to continue to update regularly as we get those official reports in. And so currently I can report on a current ICU admission.
So, sorry, that is, there was the unfortunate death yesterday. There was a ICU patient. This is a newly hospitalized patient?
Correct. This will be our second ICU admission.
Thank you.
Brandon Sun, Bud.
Yes, this is for Lanette. Can you tell us why you decided not to pursue the MPI Dauphin for the Center for a Site?
So that is an operational decision with the Regional Health Authority, and I understand there was some more conversations happening within the community about where the best site would be for a testing center. So I think those conversations are ongoing.
Okay, so you have no idea what made it not suitable at this time.
I think there were some concerns expressed by some community members, and they just wanted to make sure that those voices were heard and that they had a solution that everybody was happy with.
Okay, thank you.
You're welcome.
From 102.9, Natalie.
Good morning. I just have a question for Dr. Brent Roussin. Are the 3 cases that were announced yesterday, are they still under investigation at this point?
Yeah, there will be certain aspects that are ongoing. They would be contacted and ensured they're being isolated, and then the contact investigations are ongoing. So there's many various contact investigations going on at the same time, so I can't report on any details of those 3.
And just a quick question for Lanette. A number of veterinarians announced that they would be donating ventilators to the province to help with this. Has the province received donations from vets, and if so, how many ventilators were donated?
I heard that too, Abby, and I was really excited to hear that. They haven't gone through me directly, but certainly any donations are always welcome, and they can connect either through Shared Health or Manitoba Health, and we would have that conversation about how we can look at what equipment they have available, and if we can put it to good use.
Perfect, thank you.
All right, we're going to our second round of questions. Again, if you wish, a primary question and a follow-up. City News, Stephanie.
I don't have any further follow-up. Thank you.
Bryce from CDC Manitoba.
Hi again. So at an earlier date, you mentioned that there were plans underway for a reporting system for those who see people not complying with some of these orders. What's the status of that? Is that still kind of remain within the purview of the health inspectors?
That's right. For the business aspect of it, it's the health inspectors. We we really don't want to get to a point where it's the people are calling to report individuals. With it, we really want to have these orders in place, like I say, are just an additional tool that we have to get our messaging out, to certainly allow for enforcement if necessary. But really our messaging is that now's that time for Manitobans to all know their role. We're all working together. We're all in this together. We're escalating our messaging. But again, this is not all about writing orders. It's not about giving fines or any things of the such. It's about Manitobans stepping up, doing what they can to limit the spread of this virus, staying home when they can, and then practicing that social distancing as much as they can. There should be strict adherence to those social distancing messages. And then as we're escalating it, we have those limits on certain businesses, certain public places. So if need be, we can enforce it, but we don't want to get this into where people are calling, reporting their neighbors or things like that. It's just very difficult to enforce that type of response.
Okay. So you haven't had to enforce it yet?
Not with any fines. We've had very proactive public health inspectors meeting with a number of businesses, advising them of the requirements for them to to comply and providing advice on how they can comply.
Okay. Sorry, I didn't mean for that to be a follow-up per se, but I just wanted clarification. I do have one other question. I'm curious to see what your message is to different faith communities. This effect of limiting gatherings to 10 people comes into effect in a couple days. Tomorrow's Sunday. What do you say to the folks who still want to try to get in one last church gathering?
I would say that we're in a pandemic, and that our messaging now is that we need to act now. And so we've said all along that social distancing, physical distancing, is not social isolation. So you want to ensure people are staying connected, especially to their faith-based organizations, to find ways to remain connected, to ensure we're connected with vulnerable groups. But right now we're trying to reduce the impact of this virus, and so it's causing difficulties on a number of individuals, a number of groups, but everyone's going to do their part to limit the spread of this virus. So that would include gatherings such as you just mentioned.
Okay, thanks.
From the CDC Ontario, Canada, Catherine. CTV Winnipeg, Jeremy.
Hi there, Jeremy from CTV Winnipeg. Wondering if you can clarify again what the symptoms are of the coronavirus. We've had a few people calling in with questions for us about what specific symptoms are. If you can just clarify that again for us.
Right, so the most common symptoms are respiratory in nature. So fever and cough are very common features of this. You can have other symptoms of respiratory illness, shortness of breath. Other people describe malaise, feeling very tired. The runny nose can also be an aspect. So though that fever and cough is by far the most common, but shortness of breath, fatigue, these are all certain symptoms that we see as well.
And wondering, the Public Health Act coming into effect on Monday includes some stricter regulations, and you mentioned that that won't be yet applied to places of work or employment. Have you thought about pushing that further and implying those restrictions at places of employment? I've received a few calls, one as early as this morning, about people who are concerned because their employers still asking them to come into work.
Yeah, so we are constantly looking at those type of factors, and we're going to continue to escalate our response. We're going to do what we can to limit the impact of this virus while ensuring that Manitobans still have access to necessary supply chains and other types of necessary services. So we're moving forward, constantly looking at our plans. But I would say again that no Manitoban should wait to see if an order applies to them. This is not about orders. This is about Manitobans stepping up to prevent the spread of this virus. So whether an order applies to you or not, you should be doing whatever you can to enact the social distancing strategies that we've been messaging now for a couple weeks. So that's the advice, is that everyone has a role. Know what that role could be for you and start acting it. Don't wait to see if an order applies to you or not.
From the Winnipeg Sun, Josh.
Hi, it's Josh Alder from the Winnipeg Sun. I'm wondering if the province is working on a list of businesses it considers essential businesses and looking at public, as other jurisdictions have, and if they are looking at enacting any kind of these similar acts that other provinces have, limiting only active businesses to essential services.
Right, so we haven't taken anything off the table, any actions that we think would protect the health of Manitobans. So we're looking at all of those types of options, and so we'll continue to message as we know more about that.
you've had a lot of the same messaging from before this really impacted Manitoba in terms of social distancing and self-isolation, all these types of things. Are you finding a lot of resistance to this? I mean, yesterday we updated, or not updated, but you put into place information, check stops at the border. Are you finding a lot of people?
Context, or how should people take that kind of information on board right now?
Yeah, and so these are the numbers that we expected to see. These are numbers that we've been planning all along to see, and we know that we're going to expect numbers to increase over time. We're going to see community transmission here in Manitoba, and so it's what we've been preparing for. We know that some of these numbers today reflect a change in our reporting where we're only reporting once a day. Some of these numbers would have been reported out in the late afternoon yesterday due to our old reporting method. So for today, it does seem larger than what we would have seen if we were reporting out twice a day. But this is what we've expected for. And again, this is not the time for fear. This is the time for knowledge. Time for credible information, and it's time for action, right? And so if you haven't been able to implement those social distancing strategies yet, start today. It's not too late. We can interrupt the transmission starting today if everyone starts doing their part, and that applies to everyone, all Manitobans, all employers. We can make a substantial difference in the transmission dynamics, but we need everyone to act.
From Global News, Eric.
This is Eric from Global. Why not implement the ban on gatherings sooner rather than later, considering the recent spike in cases? And by that I mean from banning gatherings of 50 down to 10. So the ban starts on Monday. Why not start now?
Yeah, well, my message would be the same. Don't wait for an order to apply to you. Start social distancing 2 weeks ago when we started announcing the importance of it, but certainly start today. This is not about orders. This is about Manitobans implementing actions right now that will reduce the spread of this virus. It will protect them. It'll protect people around them. It'll protect all of Manitoba. So don't wait to see if a specific order applies to you or not. Act today.
That's my question for now. Thank you.
From the Brandon Sun, Bud.
Yes, hello. Dr. Newton, the Prime Minister announced that starting Monday, Transport Canada will not allow anyone with symptoms to board a plane or train. Will Manitoba Public Health play any role in that at all?
That's, those type of orders, the federal guidance, we sit frequently with our federal counterparts and other provincial and territorial counterparts. So those are all good social distancing messages. We probably won't be specifically involved in those categories of transport, but the messaging is the same. That's we support that, and it fits with our social distancing messages. So we work with all of our partners, and our messages are quite aligned.
Okay. From a health perspective, from your perspective, are you getting everything from Ottawa that you need in Manitoba to battle the pandemic?
Sorry, I didn't catch that one.
The question was, from your public health perspective, are you receiving, or would you like more tools coming from Ottawa to help Manitoba, to help your battle against the pandemic?
Oh, I sit multiple times a week on the Special Advisory Committee of the Council of Chief Medical Officers of Health, and on that table is our federal Chief Medical Advisor, Chief Public Health Officer, and so we're connected. So all of these actions are after a lot of consultation, and we're quite working together quite a bit at that table. So I think we're, nationally, all the provincial and territories, we're quite aligned. So moving forward, we're going to need the support of the federal government, of all the provincial and territorial governments to continue these strategies.
Great. Thanks for your time, guys. That's it for me.
From 102.9, Navi.
Hello again, Navi Ball with 102.9 CHCM. Now that the gatherings have been limited to 10 effective Monday, is the province more actively considering having temporary infrastructure either built or brought into communities for self-isolation that don't have those structures in place already, like, for example, First Nations communities?
Mm-hmm. Well, we are working with the First Nations communities through the federal groups. So we do have guidelines and suggestions, and we certainly are wanting to support. I think each First Nations community will need to come up with their local plans. So looking at potentially schools and how do you self-isolate in the home, or if necessary, what are some alternatives that we can support as well. So those conversations are ongoing, and they're good conversations to keep happening, and however we can support, we will.
Thank you.
At this time, we'll open it up for any final questions.
I had one. This is Aldridge with the Winnipeg Sun. For a bit of a different story I'm working on. As we look on, as these numbers start to increase, we hit a milestone with our first death. When we look back at past pandemics, past issues like the Spanish flu, what types of things have you learned from those that we're applying today? What kind of lessons? And can you even compare what happened, say, 100 years ago with the Spanish flu to how things are processing now and proceeding now and moving forward?
Right. So, this virus is not the flu. There's certainly differences between it, from things like previous pandemics, things like SARS, H1N1 of 2009. We learn a lot about our method of preparedness. From some of the pandemics in the past, we're looking at the evidence of their social distancing strategies that they've used at that time. We're learning actually from other jurisdictions right now on the strategies they put in. And so, yes, we learn from these aspects. Certainly each pandemic is unique. This is not the flu, this virus. And so there's uniqueness on there. And I think that from the evidence that we're seeing in many jurisdictions, good social distancing strategies are effective at lowering the impact of this virus. And so that's a major thing that we're working on now.
Thank you. Hi, Bryce Lloyd from CBC Manitoba. I'm not sure which one of you want to take this, but have any of the previous cases begun to recover yet? I know it's been about 2 weeks since we had our first few announced.
Right, so it's a good question, and the short answer is yes. I don't have official reports of that, but from the evidence that we have on the transmission of this virus, a person who is recovering at home 14 days after the onset of their symptoms, they will be considered recovered. They will no longer need to isolate. They won't need a test of cure. They will be recovered. And so you can follow our timeline that we're going to start being able to report on recovered cases very soon.
That's it for me.
Anyone else? All right, thank you. That concludes today's media briefing.
Thank you.